Hi, welcome to today's episode on fall prevention with beds. We're looking at how can your profiling bed, your height adjustable bed help with preventing falls and injuries related to falls. So there's a few risks with beds where if we have a client that is thrashing around in bed, maybe someone that's disorientated, there is a chance that if their bed's really high up, that they can roll off the bed, and if they fall from that height, they could have very, very serious injuries. So something as basic as having a bed at a lower height can reduce fall injuries or the severity of those injuries. So this is where you look at things like your high-low beds or floor beds, where the bed almost goes all the way down to the floor. And something that we do need to take into account with a high-low bed or those beds that go all the way down to the floor is that you might have a client that does have that disorientation, and they might be very confused that they actually do try to still stand up out of the bed even though it is all the way down to the floor. So some beds actually don't go fully down to the floor and actually has like a safety stop where it only goes to about 200 millimeters from the ground, and then there's a second button that can allow you to go all the way down to 100 millimeters. Now the reason that they would do that is because there is a height which that 200 millimeters could be the height where the client is still at a low enough height that if they were to roll out of bed, they're not going to have severe injuries, but it's safe enough height for them to still be able to do a sit to stand out of the bed. Because if you think of a bed being completely on the floor, if you try to stand up and that it's that low, there is a chance that you'll actually fall. So we do have to find that fine balance between a low bed but not too low bed. Then you do have other fall prevention features like having a bed that has caster breaks, because you could have the risk of the client trying to do a sit to stand out of the bed and then the bed starts moving away from them before they're fully standing. So having a way to ensure that the brakes are all engaged and easy to operate. So this could be something like your tandem brakes, where you can actually engage all four brakes just from one side. So that means you don't have to walk around all four corners of the bed to put the brakes on, especially if your client has a bed up against the wall. You might not be able to very easily access those two casters. So having just a caster for the back and front of the bed, but then at the same time engaging the brakes on the other side. So that's what tandem brakes would help with. And then we might also, for some severe cases of clients thrashing around in bed, we might want to look at things like your bed rails or padded side panels. If you think of someone with like Huntington's, they typically have those beds that have like the sides that come up that are padded, and this prevents them from getting injuries when they're thrashing around in bed, but also prevents them from falling out. Now, the thing that we do need to take into account when we do have those side rails is that there is that risk of entrapment, or that risk of the client, let's say they're rolling and they have very limited bed mobility, they might actually have their face all the way up to the side rail, and then if it's not a breathable material, if it's a thick side paneling, it could be a suffocation risk. So having side panels that maybe have a mesh or some breathable material, and making sure that those side panels can come down very quickly so that caregivers can assist the client if they need to get to them and it's not difficult to access them. And then also be able to see, because if you have those very high side panels, you might not be able to see that the client is in danger or there's something wrong. So having side panel mesh that's see-through, but also take into account the size of those holes. You don't want a client to be able to push their finger through and their finger's getting stuck through it, but you want to make sure that it's still breathable and you can see through it. So you kind of have to find that fine balance with the mesh side panels. And then we also want to think about those infill bolsters. So having bolsters on the side of those panels as well, that there isn't a gap between the side panels and the mattress, and that is then an entrapment risk. A common issue with some beds that have that those side panels, those Huntington type beds, is that it does in some cases add quite a lot of extra width to the bed, because they could be very thick, and that can make it very difficult to get to the client. Because imagine it is a king single bed, but now you have these very thick side panels on both sides. It could be very difficult for the caregivers to reach to the middle of that bed to be able to assist the client with, let's say, sling application, dressing changes, hygiene purposes. So even though we want to prevent falls with having those side panels, we do need to take into account the drawbacks of those as well, and what are things that we need to look out for. In our previous episode, when we talked about pressure care, we mentioned the size of the bed. Well, the size of the bed also comes into play when we look at fall prevention, because again, if our client is in a bed that's not wide enough, not only are they not rolling often, there is actually that risk that they can try and roll to reposition and then actually fall out of the bed. So if you have a bigger client, you want to make sure that the size of the bed is sufficient for that. So let's do a recap of today's episode. We talked about fall prevention features like your high-low beds that have height adjustments and can go very low to reduce the distance that someone might fall out of the bed. We talked about having that fine balance between being too low on the floor and maybe having a client that still tries to stand out of bed and needs to be able to do that safely. We talked about our side panels or side rails and some of the risks involved and how it does prevent falls but does have its own drawbacks. And then we also talked about the size of the bed being important for safe bed mobility but still preventing those falls out of the bed. We also mentioned the brakes on the caster wheels of the bed being a very important feature, because we have that risk of a bed not having the brakes engaged and the bed moving away when the person tries to stand up. We'd love to hear from you in the comments. Have you had any cases where clients have had falls out of bed? What are some of the solutions that you've come up with, or what are some of the features of profiling beds that you found helpful? Stay tuned for our next episode on pressure care.